Welcome back. As the number of COVID cases continues to rise in the upper Midwest, many small rural hospitals are overflowing and schools are making tough decisions. In this week's AGWEEK cover story, Noah Fish looks at how small towns are coping with the pandemic.
Our ambulance transfers have tripled. Our emergency room visits have tripled. I think my staff is tired. I think they're exhausted.
In recent weeks, North Dakota has become the nation's worst COVID-19 hotspot. It has the most cases and deaths in the U.S. Beverly Vilhauer, the CEO of South Central Health in AGWEEK, North Dakota, says they're dealing with increasing COVID cases.
It really didn't peak until about 6 to 8 weeks ago. Some of the people maybe in these areas, they didn't take it seriously.
South Central Health is a small critical access hospital. The town of AGWEEK owns a hospital and clinics in neighboring small towns. Vilhauer says COVID has limited their ability to transfer patients to bigger hospitals as they usually do.
But now with COVID, those hospitals are full. Their ICU beds are full.
So instead of transferring them, they're forced to keep more of the non-critical patients.
Over the last 6 weeks, we've really had a struggle with the patient beds and the availability of an ICU bed.
Blooming Prairie, which is near Minnesota's southern border, had to cancel the homecoming football game after a player was exposed to someone with COVID-19. That's a big deal in any community, and Activities Director Allison Mack said it was a very difficult decision to make, but she says everyone seems to be supportive.
Certainly it's disappointing, but we've always, worked to make sure everyone was safe, first and foremost.
So while COVID, closures, and cancellations ripple through rural areas, these communities are trying to stay positive. This is Noah Fish for AGWEEK.